Hi, my name is Chris LaJoy, and I'm the sleep specialist for Great Lakes Orthodontics. The OSA demonstrator has been an ideal complement to the dental sleep medical profession. When describing your patient's conditions using the OSA demonstrator, you can show them in an upright or a supine position. Once your patient has been medically assessed and determined that the patient is a candidate for oral appliance therapy, this OSA demonstrator will help you describe to the patient their condition. It has 3 movable parts so that you can show the patient if they have swollen tissue in the back of the throat by sliding that forward. In addition, sometimes there's fatty deposits or the tongue is actually swollen from all the battering that takes place with the chronic snoring. Then you could show that the tongue is enlarged and how constricted that becomes in the airway. In addition, the third movable part is the case of the elongated uvula. Many times these patients breathe out of their mouth, which will then actually suck the uvula into the airway. So you can show the patient that sometimes can also be a part of the patient's obstruction. If the patient has been diagnosed with chronic snoring and obstructive sleep apnea, the contributors can also be hypertrophy of the adenoids as well as the tonsils, which you can clearly show the patient with these 2 removable parts. The referring physician has already agreed that the optimal treatment will be an oral appliance. Once the oral appliance is placed into the mouth, it will temporarily bring the lower jaw forward during sleep. And this is exactly what you can show the patient, how that works. Now with the mandible being forward, this will allow the shrinkage or the normalization of the soft tissue, and you can show the patient that as well. It is allowing the tissue to heal, but even more importantly, you can show the patient how much greater that airway becomes. The OSA demonstrator is one of the best educational tools to illustrate to your patients their conditions and the benefits of oral appliance therapy. So by convincing one more patient in your practice that they are in need of oral appliance therapy, the OSA demonstrator has more than paid for itself. Feel free to contact me here at Great Lakes if you need further information about the OSA demonstrator. Thank you.